Hi, come on in. Yeah, take a seat. Hi, yeah, it's your first time in, right? Well, welcome. I'm so glad you came in today. Um, we're doing just a typical cleaning and general inspection of your teeth, make sure everything's okay, right? You didn't have any major problems? Okay. All right. I did see on the paperwork that you had noted that you have a lot of dental anxiety. Is that correct? Yeah, no, absolutely. That's a very, very common problem. It's actually something I deal with as well. So we actually specialize in anxiety with our patients who've maybe had something negative in their past as far as dental, procedures or anything like that. We can really help manage anxiety and get your oral health where it needs to be. So something we like to do with our new patients is just kind of go over general information, and sometimes having that information helps kind of ease the worry. I know it's hard giving trust over to someone, especially when you can't see what's going on. So we like to kind of walk you through everything. Does that sound good? Okay, great. All right, I always like to bring up my little trusty my model here before we get started. So basically what our exam today is just going to be doing is going in, we're going to be doing the cleaning, obviously, we're going to do your x-rays, we're also going to be doing some scans. So basically what that'll do is let us have a good overall picture of what's going on inside your mouth, right? So the x-ray will let us know what's going on inside of your teeth and underneath your gums that we can't necessarily see with the naked eye. And then the scans help us get like a 3D image of the teeth, which would help kind of tracking throughout time. So if anything changes, like with your bite, or if you think like maybe there was a chip or something, we can go in there and check. Or if we have to do anything, more than just the standard cleaning, we'll have information to work off of in the future, okay? So none of that should cause any pain. It's just a bunch of machinery in your face, right? Okay. And then the actual exam itself, we're going to be going through and not only cleaning out between the teeth and just under the gum line, making sure everything looks good. We're going to be checking the gums to make sure they're nice and pink, that they're not red, that they're not puffy, because that could indicate that you have some buildup in there that's causing irritation. And obviously we don't want that, whenever you get buildup and you start to see receding gum lines, and then you start getting sensitivity, So we always want to make sure that our gums are nice and healthy, and that we're also taking care of the teeth themselves. So we'll be checking all of the surfaces, front, back, and the actual bite surface here to make sure that there aren't any spots that we need to worry about, any areas that are concerning or that we just kind of need to have on our radar, okay? Okay. And then also, just as far as day-to-day cleaning, we always want to make sure that we're moving our brush in circles, up and down, not back and forth, right? Okay. We always just like to make sure people got the memo, because a lot of the times, you'll see cartoons growing up and you see just things growing up where you just see people doing this all the time, and it's not very effective when we're talking about really getting in there just underneath the gum line and along the gum line, because that affects our oral health a lot as well. So that circle really helps doing that, and then kind of angling it down, right? Okay. And then whenever we're talking about flossing, and I'll show you whenever we get to yours, not just going straight up, but going straight up, kind of hugging one side, shimmying it down, and then hugging the other side and shimmying it down. So there should be like 2 pieces per space, right? So shimmy and shimmy, right? Okay. So this is our little model, and if we need to pull it out later to help, pinpoint anything, we can do that. So it makes it easy. It's a lot easier than you having to try to do that. So this little guy we like to use the most. Might bring that out again. A couple of the things that you might see today. Let me go over like the tools that we'll be using. I think a lot of the times these cause a lot of anxiety just because they look scary, right? They look really pokey and scary, and they look like they might hurt. But the object of the tools is not to actually poke you. It's more to make sure that the surface of the tooth is has good integrity, and make sure that we can get along the gum line, really precision work for cleaning. And then also in those tiny little spots that are hard to reach between the teeth and maybe like on the surface, on the bite surface, that are really hard. You know, they have like little pockets in there that are hard to get. So the ones you're probably going to see the most are going to be our dental probe and our dental pick. They look very similar. Both of these allow us to get in and get a little bit better of an angle for cleaning, right? So they shouldn't cause you any pain. If you start getting any irritation or anything with these while we're cleaning along the gum lines or anything like that, you let us know. We'll stop and we'll take a closer look, okay? And something else you might see is just a little mirror. We use this to help. And like, again, those hard to reach areas, like way back here, you know, we need to be able to see what's going on. And sometimes it helps just to have like a mirror to give us a little better image that we can't, you know, physically get in there and see, right? Okay, so that one's gonna be coming out a fair bit. And then, you know, if we have to add any water, you might see the water come out. Whenever we get a buildup of any kind of water from like flushing, or, you know, if saliva collects, no big deal. We'll just, you know, insert the little suction and have you close your mouth around the section, and that'll just suck it right up, no big deal. And also, we also like to use, it's a bite block, and it helps during the exam itself, because people get tired, you know, your jaw gets tired of having to hold it open. So we can just pop that right in there, and you can kind of rest it between your teeth while we're working. And then we move it whenever we need to work on those teeth, okay? Okay, great. All right, do you have any questions, or are we good to go ahead and get started? Okay, yeah, just take a deep breath. We'll go slow. And if you have any pain, any discomfort at all, you let me know and we can stop, okay? All right. Okay, so before we actually start doing the cleaning and the inspection of the teeth themselves, we're going to go ahead and do your x-rays and your scans so we can look at that and have that information while we're actually doing the cleaning, okay? Okay, great. So thankfully, x-rays have come a long way in the last several years. They're not nearly as uncomfortable as they used to be. Whenever I was a kid, I remember the bite, little piece they had to bite down on, it really hurt. Those things really hurt, like they hurt along the gum line and everything, but these are a lot smaller and a lot softer. So I'm just gonna place these in various areas and put a vest on so you're protected, and we'll just take the pictures and move on, okay? All right, can you open for me? All right, bite down right there. Perfect, perfect. And we're gonna go ahead and just put this vest right over you here. Does that feel comfortable for you? Okay, adjust it a little bit here. How's that feel? Okay, cool. And the bite, does that feel okay? No pain? All right, we'll just hold right there. And in 3, 2, 1. Okay, open for me. All right. Let's get another one going. Open for me. All right, and close. All right. Okay. Go ahead and open for me. All right, get another one going. We're gonna do this front part right here and bite. Perfect. All right, go ahead and grab this. Do the other side here. Open. Okay, and bite. Open for me. And this should be the last one. Okay, open. Right. Right in there and down for me. Okay. All right. Perfect. You did great. How was that so far? Nice. Okay, you did awesome. And we're going to go ahead and take a look at the x-rays in just a minute, but we're going to go ahead and do the 3D scan of the surface of the teeth, just so we have that available as well, okay? All right, so you can go ahead and open for me real wide. Okay, we're just going to, it's just a little device. It goes in there and we can kind of move it around. It'll kind of make some clicking noises. Nothing that would hurt or anything like that. Okay, open. You're doing great. Okay, got that side. We're gonna come in on the other side here. Just open for me. Okay, good job. And I'm gonna go ahead and swap out that vest that we were using for your scans and your x-rays. And going to go ahead and just use a regular blanket unless you don't want it. A lot of our patients find like having just a blanket or a weighted blanket just helps ease the anxiety and some of the tension while they're actually getting the exam done. Does that sound good? Okay. All right, so I'm just gonna pull this guy off. We have this nice plush little blanket. It has a little bit of heft to it, so it's sort of like having a hug while you're getting your cleaning, okay? Okay. Try to tuck you in a little bit here along the sides. Do you want your arms in or out? Okay. All right, here we go. How's that feel? Okay, so I think we're about ready to start the actual exam and the cleaning. Something we do like to do is go ahead and give you just like some lip balm, so that way your lips aren't getting cracked and, you know, while you're having to hold your mouth open wide, it kind of, you know, sometimes starts to hurt. So we like to go ahead and put some lip balm on unless you're opposed to it. Okay, yeah. I always find that to be helpful. So let me just get a little bit of this on here. Right. Just how's that feel? Great. And for this part, I am going to go ahead and use a mask just because I'm going to be really close in your face, and just to protect you a little better, we're going to go ahead and do that. But if there's any concern that you have, you feel uncomfortable at all, you just let me know, raise your hand, make a noise, anything, okay? Okay. Okay. Alright, go ahead and open for me. We're just gonna start real slow for me, okay? How's that feel so far? Okay. That pressure's okay. Alright, we're just gonna go ahead and clean just along the edges here, making sure those gums look nice and firm and pink like we like, that there's no bleeding. Checking to make sure there's no receding of the gums. And cleaning off those teeth, okay? Okay. just those little hard to reach spots that, you know, food might collect. It's nothing out of the ordinary. It's just hard to get to them with, you know, your regular tools at home. So you want to make sure you get like a really deep clean one in here. I always like to say it's like the spa, but for your teeth, right? I'm going to do the top of here. You're doing great. How are you feeling so far? Okay. Okay. How's your jaw feeling? Do you want to go ahead and use the bite block? Yeah, okay. I didn't want to start out there in case you didn't need it, but a lot of people will find it's more comfortable. So let's go ahead and do that. Just open real wide and I'll put it on this other side for you. And just rest your jaw there. Yeah, perfect. And I'm going to come in here with just some water, just rinse off the area. So it's just rinsing away the stuff that we cleaned off and that we have like a nice palette to work with, right? Okay. And you can come in here. I'm just going to do the suction for you and just wrap your mouth around it. Yeah. And again. Yeah. And if you need that at any point, let me know, because people have different thresholds on, you know, what's uncomfortable, right? So, okay, so I'm going to start moving around to the front a bit. Okay, so we're going to do this bottom area. No pain there or anything? Okay. All right, and let's look underneath here. Okay, all right, let's just go ahead and do no pain there? Okay. You're doing great. You're doing great. All right, I'm going to do a few more spots under here. Okay. Come through with the water again. Just do a little bit of a rinse. Okay. And the suction. Okay. Perfect. I'm going to go ahead and remove the bite block from the side. And since we're moving sides, just pop it over here real quick. And go ahead and rest. Perfect. Alrighty. We're in the home stretch. We're really close, okay? You're doing great. Okay. Yeah, okay. Yeah. You're not having any sensitivity along here at all? Oh, but on the upper? Okay, hold on. Let me see. So you have some sensitivity along the upper side, like around here. Is it on the tooth itself or is it along the gum line? Okay, so it's like in through here, right? Okay. All right, I always like to be aware of that before I get in there. A lot of the times what happens is whenever we're brushing our teeth, if it's the opposite side from the hand that we use prominently, we hold our toothbrush at a different angle. So sometimes we can tend to like brush too hard and it causes a little more irritation on the opposite side. So that might be what's going on, but we'll take a look. Do you want me to go ahead and just use like a little topical anesthetic so it just doesn't bother you, or that the water doesn't bother you? Sometimes the cold water really bothers that area a little bit. Sure, yeah, we can do that. Now, full disclosure, this doesn't taste the best, but it does work as far as just numbing up the area. So let's just give it a little. Okay. Just gonna come here, get a little bit of this product. We don't want a ton, because then like your whole mouth will be a little numb, so we don't want that. And so open for me. I'm just gonna come in here, get it right along that gum line. It'll just numb everything up. And so if you can kind of keep from touching that with your tongue, not only will it wipe off the product, but it also numb your tongue. And it's not a sensation people love to have, it's not gonna hurt anything, but just to make life a little bit more pleasant for you. So we'll just give that a second to kick in. Okay. All right, we're almost done with the part I think people, dread the most. So you're doing great. All right, let me just get in there real quick and we'll just keep on going. I do see what you're talking about, like with the little area that's a little bit irritated. It does look like the gums on that side are just the tiniest bit receded, but again, it could just be from hard brushing, so it's nothing that won't resolve on its own or anything you should worry about right now. You're doing great. It looks like you've been doing a really good job keeping your teeth clean. Okay. Okay, let's see here. All right. Hard part's over. The rest is a cakewalk. So we're gonna come in here. We're gonna just flush that area a bit. And we're going to do some suction there. Good. Okay. And just move it all around inside your mouth. Get any of the extra from the cleaning part. All right. Go ahead and take that bite block out of there. Okay. So now we like to go in and do a flossing, just so that we can make sure that the contact between teeth is enough for us to be able to actually get a good bit of floss in there, right? And that we don't have any concerns with contact points with the teeth, right? Okay. Start here, and we're just gonna start on this side, okay? Okay, and like I was saying before, what you're wanting to do when you're flossing is come up on one side of the one tooth, side of the contact, shimmy down on that side, and then come back up on that same contact area to the other tooth and shimmy down on the other one, okay? All right. Right here. Ooh, lost it. And we can come around this way. We're going to come in and do the bottom. And now that we're done with the flossing, we're just going to do another rinse, another suction, and then we're ready for polish, okay? Okay, so just do a little rinse through there, rinse through here, rinse through here, rinse through here. Good, 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 good. You're doing a great job. How are you feeling? We're just gonna come in here, do a little suction through here, clean everything out really good. Okay, and for the final part, we're just gonna go up and polish up all of your teeth, have them nice and shiny for you. And we do have an option on the flavors. You have an option of grape, spearmint, or bubblegum. Which would you like? It's a popular choice. Okay. And this little guy, it just has like a little polish head right here. It's just going to go in. We're going to get all the surfaces of each of your teeth. And then we're going to go over your results for the x-rays and anything we're going to need to do moving forward, okay? Okay. Almost have you out here, okay? Okay. Open wide. Okay. Okay. Yeah. All right. Okay. You can move on. Work our way back again. All right. Okay. You're doing such a good job. All right. And we're going to come through, do another rinse, do another section, and we are done with that. Okay, do a rinse here. Rinse up here. Do the suction. All right, and close one more time. Perfect, perfect. You did an amazing job. Okay, so I can go ahead and take this back off. Please. And we can go ahead and put your x-rays up on the screen if you want to look at them, but if you don't want to, or if it's going to cause you more anxiety, we don't have to do that at all. Okay, well, no problems. And we can do that down the line if you'd like. But what I'm saying is there's just a couple of contact points that aren't cavities. They aren't areas that we need to actively worry about. Just things that we need to take, just being more aware of whenever we're doing our daily like flossing and brushing and things. It's just the contact areas in the back. It's very common for people to have issues back there just because it's so tight and it's hard to get. So just make sure you're spending a little extra time back there. It's nothing to worry about right now. We're just going to keep an eye on it, okay? Maybe like it's thinning a bit. Okay. And so everything looks good so far. You didn't have much bleeding at all on your gums, so I can tell you're really taking care of them. You did a really good job with that, so keep that up. A lot of the times people find it easier to use either an electric toothbrush or the water pick instead of actual flossing. It helps kind of get into some of the weirder angles and everything. So those are always options, and we suggest doing that if that's something you want to look into. I get that not everyone has the budget for that, and it's totally fine. But those are good options as well. And then if you're still having areas that are sensitive along the gum line, while they're healing up a little bit, we'd suggest using like something like a Sensodyne or something like that. And you can actually use it almost like a little mini mask for your teeth and gums. So just after you're done brushing, just maybe put a little extra up there and let it sit and then flush it out. But it really does help kind of make the area a little less sensitive. Okay, so you are all set. Did you have any questions for me? Okay, I'm gonna go ahead and get this off of you because you're probably nice and toasty at this point. But if you want to stop in with our front desk, they'll get you set up for your next appointment, so we can just keep on top of making sure everything's good with your oral health. But you did an amazing job today. We definitely want you to come back in if you have any questions or any problems. In the meantime, definitely call us. We're here for you, and anything we can do to make things easier, make the process easier, just let us know, okay? It was so good to meet you, and we'll see you next time, okay?